art and science, creativity and passion, beauty and anatomy. Where most see a face, I see a canvas. This season, the spotlight is on artistry, the intersection of form and function, harmony and healing. Every facelift, rhinoplasty, and every transformation begins with an artist's eye and a surgeon's skill. Go behind the curtain, into the consultation room, the operating room, and the recovery journey. Witness real patients reclaim confidence and discover how beauty just isn't restored, it's reimagined. Because when medicine meets the soul of an artist, the results go beyond the surface. A lot of times when people think about art, when they're thinking about music, they have this idea, this concept of something called a flow state. This is when you're kind of out of body, and your subconscious and your conscious mind kind of meld together. And you're there and you're present and you're just hitting 3-point shots, all right? Steph Curry. Maybe you're playing music and you're just bringing something forth. You're writing a hit piece and you don't know where it's coming from. That's how I feel almost every single time I go to the operating room. It's like something just coming out of me. And that is that feeling that I try to evoke every single time I touch a patient's life. Okay guys, season 3, Beyond the Surface, we're back. People have loved season 1, season 2, we transformed lives, patients love the stories. So we're gonna go bigger, we're gonna go better. Are you excited?
Yes! Yes! We're so excited.
Crystal, kick us off. Who do we have this season?
So our first patient is Casey. She is so excited to meet you. She found us on the show. Actually, she loves you, loves Juliana, Southern Belle from Louisiana. Been under a ton of stress. She wants to get back to how she feels.
Okay.
She takes care of everyone. It's time for her to take care of herself.
We'll help her.
Up next, we have Devorn. Devorn feels like she's been botched. She's had a couple different procedures in Korea, a couple with different local plastic surgeons. She wants you to make her look natural and beautiful again. She's trusting you to make that final step.
All right, I've got my work cut out for me because revision surgery is always harder.
Yes,
so,
definitely.
But I love it. Do it. Next.
Up next, we have Veronica. Veronica had a rare form of cancer. She has facial paralysis. She can't smile. Like she has tearing in her eye. So you're gonna have to do your magic with this one, facial reconstruction, to bring her smile back.
Okay, I'm gonna put my creative cap on for that one. Always love a good challenge, but really can't wait to help her. She's been through a lot.
Yeah.
All right, Jessica, who do we have next?
So we have Miss Doreen. She is 71. She goes by Diva. So that should give you a little intro into how her personality is absolutely fantastic. She kind of reminds me of Christine from season 1 in the sense that she doesn't really feel like she looks how she actually feels on the inside.
We're gonna match the two.
Correct.
Beautiful.
Correct. Okay, and then we have Dina. Dina is 61. She is from Texas. She was also a military medic for 31 years, so she has a lot of sun damage.
Okay.
For her, we're gonna be doing deep plane face and neck lift, upper bluff, ponytail brow lift, lip lift, CO2 laser, face, neck, chest, hands, and then I think we're gonna do a rim graft as well.
All right, so basically every single part of the face is getting touched.
Yes.
That's gonna be great.
Next we have Anne. She's 67 and from Texas, and she has spent the last year working on herself, kind of doing an internal glow up, and now she's ready for the outside.
Outside, love it.
Your last canvas is Chanel. She's 41 from Florida. She's an absolute sweetheart, and you are going to do amazing work on her. You're doing both cosmetic and reconstructive surgeries. She has been dealing with a cleft palate issue since she was younger. She's had over 19 surgeries. So not only are you gonna help to restore her breathing, but you're also gonna help to restore her face, and she can't wait.
Okay, great, Jessica, that sounds like a great lineup of patients. All right, Maria, you're next. Tell us who we have.
So first we got Sylvia. She's 56, she's local. She's not ready for surgery yet, but she's lost a bunch of weight with Nurse Jess. So she's gonna go the non-surgical route first with fillers, Botox, lasers. She wants to be a little spiffed up and feel a little better about herself. So
Beautiful.
Yeah.
That'll be great. So not all just surgery this season. That'll be a good one.
Yeah.
Who do we have next?
The next three ladies are dear to our hearts, all of us. Bella and Sophia, my little twinnies, are gonna have surgery, finally.
Twin daughters.
They're fraternal twins. They look very much alike, but they have a little different noses. And when they were little, they didn't want to look alike. And now all of a sudden,
So now they want a twin. They want a twin.
Yeah.
So we'll make them twin.
That's gonna be pressure on you. You gotta make similar noses.
We'll do it. Twin for the win. All right. And who's the last surprise?
Girls, finally Addie is doing her surgery. Yay. Yes, she's been bugging us since she started, pointing at her nose like, I want to have surgery. I want to have surgery. Well, you heard her.
Yeah. I mean, we've done her liquid rhinoplasty. First week, she was talking about wanting a rhinoplasty. So we're going to surprise her. It's going to be great.
Yeah.
Perfect. So that's going to be a great lineup of patients, guys. I'm super excited about this season. We're going to change some lives. Our next canvas is Anne, and I can't wait to make this a masterpiece. She's 67 years young, and she comes all the way from Texas. So when I had a consultation with her before she arrived, we talked about several things. Face and neck lift, some fat transfer, maybe something related to her eyes, but today we're gonna finalize the plan.
I cannot believe you are here.
I know, I made it! My name is Ann. I'm from Texas and I am 67 years old, almost 68. Thank you, Jessica.
Here.
I am here. I am so
How was
grateful.
your flight?
Well, my flight was good.
Okay, good.
Started off bad.
Uh-oh.
Left my food in the lift. Left all my goodies in the lift.
You guys, I told you
Then,
to calm down.
I
get the
know.
nerves
Yes,
out and
yes,
away from
yes,
you.
yes. I thought I did,
got
but I
you.
didn't.
Part of her treatment team, guys, it's not just me, it's a whole team that makes this magic happen. Jessica has been guiding her through her surgical process. When Anne first called the office, it was Jessica who spoke to her, gave her the initial information, and guided her to this process of getting a consultation, booking surgery with me. So today, Jessica and Anne get to finally meet.
How are you feeling about everything? I know we haven't
I am
been able-
really good. I was nervous. I was extremely nervous, but now I'm just excited. I'm looking forward to it. I bought work that I can look at things that I'm working on while I'm here because I'm still working on the inside. So when that outside gets here, I know I'm so
It's
excited.
gonna match, and it's exactly like we talked about, where
Yes.
it's completely normal for you to still be nervous
Yes,
at this
yes,
stage in time.
yes, because
I
I'm
told you
just a
that.
little.
I know.
Yes, yes.
But we got you.
Yes.
Okay, I think Dr. Truesdale is done with surgery, so you get to meet him.
Yes.
Okay.
Yes. Thank you. Thank you. Thank you.
Of
Thank
course.
you.
Hello.
Hi, Dr.
Welcome to Los Angeles.
Thank you. I'm so glad to be here.
I'm happy you're here as well.
The way I feel on the inside, and I want it to be the same as on the outside, is I feel so much better. I feel it is my turn. I am ready to do all that I'm supposed to do, be all I'm supposed to be, and have all I'm supposed to have. There's a scripture in the Bible that says that when you lose something, you get it back double and 7 times for your trouble. So I'm looking for it, and I am expecting it and excited. So on the inside, I'm ready. I'm just ready. I really am. I'm ready.
All right, so let's chat. I know we had a consultation, but in your own words, what would you like me to do for you?
Give me back about 20, 30 years.
Okay.
Give it back.
Okay.
I've been through a lot. I've suffered a lot of losses. I lost two of my sons. I saw my mom take her last breath. My 2 Shih Tzus, 4 months apart. 30 divorce, long years. So been through a whole lot. And those things, though, are what made me who I am today. So I'm grateful because they made me the strong person I am. So now I'm looking at it as this is my phase 2. My sister mentioned about Dr. Truesdale and something just clicked. So I really believe this is supposed to happen because this is a part of my 2.0, my next level in my phase 2. And it's not that I just went through bad things, but now I'll be able to share and help somebody else.
First thing first, relax your forehead. Okay, so what I'm seeing is that you've got a lot of these little lines here. The reason why is your forehead is active, right? It's active to lift up your eyebrows. And the reason why is because your brows, otherwise, if you relax, your eyebrows would be here.
Oh my God.
Yeah.
Like what do you call those caps? The baseball caps?
Yeah.
Wow.
So we're going to relax your eyebrow and basically bring it up so that your brain doesn't have to do this for you all the time to a position more like that, okay? So that's the brow lift. I'm gonna make that cut up here, get down and lift the muscle up. So that your eyes are a little bit more open. Now,
they used to be open.
And they'll come back. They're gonna be. I wanna see a photo of you 30 years ago because I'm gonna use it as a reference. I already know what you look like, but I like to put it on the wall.
Okay.
So we're gonna bring the eyebrow up. Relax there for me. So we're gonna bring the eyebrow up like this and then deal with this extra skin above the crease of your eye.
I think that what this is gonna accomplish is I'm going to be able to walk out with a confidence because I feel like I cheated somewhat in parts of my life. I got cheated. I looked up like, whoa, you're old. You didn't get to do this. You didn't do this. This didn't work out. This didn't. So this will help me now to this part of my life where I'll be okay. I'm okay. I'm better.
The next thing that we spoke about doing is a chin implant. So your chin.
Now that I'm scared of.
Tell me why.
Because I don't want to come in the room and that's the first thing.
Jay Leno?
Man.
Like your chin comes into the room first?
Yeah. Like, hey, chin. I don't want that. Yeah. Oh, no. I don't want them. I want it to blend.
It's going to, everything.
Well, I know you know how to do that.
Everything is going to be bad.
I'm just saying.
I hear you. No, I like to hear what people are afraid of because it gives me extra sense of like, don't do that thing.
Yes.
But on top of that, it gives me sense because I know I won't do that. So what for you, if you looked in the mirror, right, as we talked about before, your chin's just a little weak here. So I don't want to give you a big masculine chin. We're just going to give a little bit of projection here, not too big.
Okay.
If I could eyeball it, it probably will be an extra small to a small size. It won't be a medium or extra large or anything like that. And I'll probably shape it myself in the operating room so that I can contour it perfectly to your face.
There you go.
Yeah.
There you go. There
so
you
that.
Go. Okay, so looking in the mirror after the surgery, I told Eddie in there, but now I forgot what I told her. But I meant it, what I said.
You want me to remind you?
Yes.
You said you're going to find yourself a new husband.
I did! I did say that. Should I say that on camera? Okay, so now I see myself in the mirror. I'm not a cougar, a past cougar, I'm a jag. And I see my hubby, he'll recognize me now because we'll look the same age. So he'll be about 30, 25 years younger, but we'll look the same age. So that's what I see in the mirror where we're both doing life.
We're gonna lift your face and your neck. Okay. So all of this looseness that's down here,
oh my God,
is going away. All of that extra
look at that
stuff. This is your muscle. And over time,
is that what that is?
Yeah, this is a muscle. It's a sheet. You see it? I have it in my hands here. It runs from your clavicle here up into your face, and over time it starts to fall down. So I'm gonna take it and bring it up.
I like that.
Yes.
I love that. Yes.
And then second to that, we will lift the face. So all of the looseness that's there is coming.
Oh yeah, that's so my boo will recognize me.
Yes, your boo's gonna see you.
He'll recognize me, there she is.
Now the other thing we spoke about doing is fat transfer. So we're gonna take some fat. If you look in the mirror and you can see this hollowness in your temple.
Oh yeah.
See where it's a little sunken?
Oh my God.
Yeah. Sunk in there. I want to put a little bit of fat in the cheek, a little bit in the fold here, and a little bit down.
Oh, that's another thing. I don't want it to be
too fat. Got you.
Yeah.
Now your earlobes here also need a little bit of fat too.
They're terrible.
They're a little small and loose. So when I pump that up, it'll actually make your earrings sit a little bit better too.
Good.
Yeah.
You're talking about doing some real stuff.
Yeah, some real stuff. Some real.
I am loving it.
And then I think we spoke about doing a lip lift too, correct?
Yes.
So if you look in the mirror, I just want to see some things. Gently open your mouth here. Just a little bit. Perfect. Oh yeah, it's gonna be pretty. So right now the lip is rounded and it's really flat there. When I do this lip lift, it's just gonna come up and it's gonna look really,
that's gonna be nice.
It's gonna look really nice.
Yeah,
it's gonna look really nice.
Oh wow.
There's one thing that we didn't talk about that, but now that I'm seeing you in person, well, there's two things. You've got the bags going on here, but then there's a little bit of extra skin. So, which we could take care of, right? So what I do is I take care of the bags, right? I do that by working on the inside of the eyelid. So there's no scars with that part. I need to take this fullness and slide it down into the cheek. The second part that is going on here is there's a little bit of extra skin here. So when I tighten this up, it looks a little bit more smooth. You see that?
Yes.
So I think we should do that.
Okay.
I'm here at your disposal, right? Like I want to make you happy, but I know if I'm trying to make you look as young as I can, your eyes used to look different.
Yes.
So
yes.
Yeah.
You can tell that. Well, you're the doctor. You're supposed to be able to tell. Yeah. You're supposed to be. Okay.
And let's see, what else? Any questions for me about anything?
No.
You're gonna look fantastic.
That's his creativity. When he sees my face, I see, ew, you got an old wrinkles. But when he sees it, it's like clay. It's like he's a sculptor or something. So that's what I see Dr. Truesdale as, a sculptor. And that's what he does. So I'm excited.
So after my consultation with Ann, we actually needed to add a few procedures to create the most comprehensive package for her, to really take her back in time. So when I met her, I could identify that her nostrils were just a little bit too splayed, a little bit too collapsed. Now, rather than needing to do a full-on rhinoplasty, I said, listen, let's just do an alarplasty. Alarplasty is where I'm shaping the wings, the nostrils, right? And so by narrowing those, I'm able to create a less flat and a little bit more projected, rounded out, and open shape. That's gonna just harmonize and balance her face really nicely. Now, we're already there, right? Because I'm gonna do a lip lift, which is really gonna create a nice, beautiful shape to her lip. I might as well just tuck in those nostrils at the same time. The cannula. The cannula is simple, beautiful, and elegant. It allows me to add fat or subtract fat, volume from the face. It is like adding clay to the structure or removing clay to the structure. It allows me to go between tissue planes delicately and atraumatically. This is like a paintbrush. It can add fat, add volume, change shape, change contour. This is a cannula. So Ann's coming back today. Our masterpiece is returning. And I get to see all of that sculpting that we did, right? The artful sculpting of the fat and the skin and the muscle and everything else that we did. So let's take a look at her. Hey.
Hi, Dr. Truesdale.
Welcome back. How are you?
Thank you.
Well, welcome back to LA. You honestly, you look so refreshed and your face is so much more balanced. I have to, let's start with just showing you. Cause I gotta.
Give me told. I know.
Yeah.
I am wonderful, feeling good, feeling great. Saw some before and afters. Wake up call.
Ann looks amazing. Her face is sculpted. She's got that volume, her chin structure, the cheeks, her eyes, the nose, the lip. She's killing the game. And she feels good. She feels confident. She looks great. But when I saw her, she was like, Doc, I don't really quite see that big of a difference. I was like, what? You look absolutely amazing. So I had to do this. And I sometimes have to do this as a plastic surgeon. Sometimes I just prophylactically put their before and afters together so I can show them where they were and where they are. And geez, she's made a huge transition.
That's crazy.
I know, right? So
oh my God.
Let's look at each little bit. So the nose, look at the nose. It's almost like I did a rhinoplasty.
I know, because you know what? At first it was just, I said, wait a minute, the triangle is leaving. And it was going more and more and more, and it's open.
Well, before, right, it was super flat and stretched out.
I don't know what happened over there. It seemed like I had a stroke and don't remember it.
And then look at the eyebrows, nice and elevated, lifted.
Oh my God.
And then look at the lip. The lip is just...
Oh, wait a minute.
The lip,
baby.
The lip was...
Tina got the legs. Miss Ann got the lips. I think the moment I had my aha, that's me moment, is how, and it's been more than one, is when I see myself and I look like, it's almost like overnight how I can't see where this scar was, that scar was, or where, it doesn't even look like sometimes that I even got surgery, bottom line. I know what I had now.
Okay.
I had the facelift. I had the neck lift.
Yep.
I had the bra lift.
Yep.
I had the, now see, I practice good at home. Name everything.
Oh, we got the camera on you. The upper,
that's what
upper
it is.
left.
The upper left, the lower left. Then I got the lip lift. The lip lift. Then I got the chin implant. I got the liposuction. Oh yeah, the nose, the ear. I got everything.
Every single part of your face was touched.
I don't know what I was thinking. I'm like, oh my God, I did all of that.
It's better to do it and not know.
Didn't think about it. Oh my God, I can't believe I did all of that. I'm looking forward to being an inspiration to other people. My thing is, I want to be able to make a person's best obvious. And this is, what do they call it when it's something that you do vain or what? It's not. It's not. It's like I said, getting something back. You're getting a second chance. Bottom line, it's a second chance. It's a second chance. And I'm grateful.